Good morning. I'm Dr. John August from the College of Veterinary Medicine at Texas A&M University, and my pleasure to be with you this morning, and I want to thank all of you for joining us on this video conference where we're going to talk about veterinary medicine, going to talk about how people become specialists in veterinary medicine. I'm going to talk a little bit about my own area of interest, which is cats. So we're going to start out with a couple of things that came out from the news in the last 24 hours, and I always enjoy sort of with my lectures and my presentations to my students to talk about what's going on in the news. And this was in the news just recently, and I thought it was really interesting. It hit the news last week. There is an island in Japan that has become overrun by cats. There are cats everywhere, and it's attracting a lot of tourists. And here's another picture that came from the news this week of all of these cats. And I think they're beautiful animals that you see there, but for the trained eye, for someone like me who's a cat veterinarian, not many of the cats look very happy. Not many of them look very healthy. And so we'll talk about that in just a little while. Cats tend to be solitary creatures, and so the idea that they enjoy living together like this is, it doesn't really make them very happy. But this was in the news this week with this, all of these cats on this island in Japan, and so I wanted you to understand that cats can be in the news, and things are, cats can be important in what we do. So what I wanted to do today was talk a little bit about what it takes to become a veterinarian, and then what it takes to become a specialist in veterinary medicine. And pictured on the screen here is one of our my colleagues who went through a training program to become a specialist with one of my favorite patients, Fiona. And to become a specialist, it takes a lot of training beyond becoming a veterinarian, and then you have to take some really tough examinations to make sure that you have all of the necessary knowledge and skills to become a specialist. And by being a specialist, you have special privileges within our profession. There are lots of different places and things that you can do as veterinarians if you want to specialize. Small animals, as one of my colleagues up in the front there in the top is working with dogs, that we have the opportunity to work in surgery or internal medicine or some of the other things I'm going to talk about beyond being a regular veterinarian. And then our colleagues in large animal medicine and surgery have similar specialties. They can specialize in equine orthopedics or internal medicine of horses or surgery of horses, or you can become a wildlife veterinarian. I've got someone in the middle here in the picture who is taking care of a bald eagle, a sick bald eagle. That takes some special training. There are people who become radiologists. There are people who become pathologists who learn to look at tissues from dead animals and understand why animals are dying, and a whole variety of different specialties. And so nowadays, with veterinary medicine being a very popular profession, people really are thinking about how I should specialize and learn how to be interested in one particular area of the profession. And in many ways, we're following the human profession with that. If you want to become a veterinarian and then become a specialist, it takes a lot of education and training. And you have to go to a university like Texas A&M if you're going to be in Texas, or if you're Wisconsin, University of Wisconsin, one of the big universities. Take 4 years of being an undergraduate student in taking your courses in chemistry and biology and nutrition and a variety of courses. And then you have to compete and apply to go to veterinary school, and that's another 4 years. And then as I came over, as you can tell my accent, I'm from England originally, but I came over to the United States, and after I finished my vet school in England, I came over and spent a year in the small animal clinic at Auburn University, and at that time did a 1-year internship to prepare me to go then and do 3 years of specialty training as a resident, and I pursued my career in internal medicine. So you can see it takes a lot of commitment, but it's a very rewarding career, not only to be a veterinarian, but also to specialize within an area of veterinary medicine and develop some unique skills that perhaps other veterinarians don't have. And so one of the questions that my clients ask me and my students ask me is, well, why do pets need a specialist? Don't they have lots of good veterinarians around who can take care of their pets? And over the past 20 or 30 years or so, pets have become part of the family. And people increasingly look at their pets as family members, and they want to make sure that the quality of life of their pets is as good as possible, that their pets don't have any significant disease problems, that they don't have any painful conditions, anything like that. And they realize that many of the same medications and procedures that are available for you and me to take care of us are also available for pets, and therefore people look to specialists. And on the screen here is one of my colleagues, Dr. Bert Dodd, in our department in the small animal clinic at Texas A&M, who's working with one of our fourth-year students who will be graduating fairly soon. And he's a veterinary dentist. He chose dentistry as a specialty. And pets have a lot of dental diseases. We'll show you in a little while with some cats. And it causes a big problem with their quality of life, with dental pain and a variety of things. So he spends all of his time taking care of animals with dental disease and preventing dental disease, and when it happens, making sure that the appropriate treatments are done. And many of the same treatments that you and I get are done on animals. And you can see that obviously animals have to be anesthetized. They have to be under a general anesthetic in order to have these kind of procedures. So animal owners nowadays have increased expectations, and increasingly they look to a specialist to deal with the skin problems or the dental problems or the heart problems or the bony problems of our patients. I specialize in internal medicine, and that's what I did. And internal medicine basically means looking at all of the problems and the diseases of animals involving their internal organs. And we'll look at some of these as we talk about them in a little while. I'm going to show you some examples. So I deal with a lot of gastrointestinal problems with animals, with liver problems, kidney problems, lung problems, whole variety of issues like that as an internal medicine person. And then I work closely with colleagues who've also chosen different specialties they want to be cardiologists and deal specifically with the heart problems of cats and dogs and horses. As you know, cats and dogs, horses have lots of problems with skin diseases, so especially in warmer climates like we have here in Texas. So it's very common for animals to need the help with their allergies and their skin problems of a dermatologist. Neurology, looking at brain and spinal cord diseases, is an important problem. It can be very difficult for us, I think, as veterinarians to be able to examine animals with neurological or nervous system problems, and so it's very good to be able to refer patients to a specialist for that particular kind of issues. And then oncology is the care of animals who have cancer, and so lots of different specialties even within small animals. And I haven't talked about those people who go ahead and deal with surgery. But let me show you another picture, and it shows you a little bit about what I do and what I've done in my career. And I chose to specialize in cats. And as you look at me here, I'm examining a young cat who is under anesthesia. And this little cat came in to see me having difficulty breathing because of an obstruction in the back of the throat. When we think about our anatomy of cats, we have to remember that the ears are attached to the back of the throat. There is a communication that happens. And so what I'm doing here is doing an examination deep inside the ear canal of this little cat to see whether the middle ear cavity is affected in this cat's problem. And so I chose to specialize in feline internal medicine, mainly because I've always felt comfortable around cats. And as a veterinarian, I felt more comfortable around cats, and cats felt more comfortable around me. And so when my clients come in the door to have their patient evaluated, it's nice that they understand that I like cats, they can see that I like cats, and it makes the cats feel at home and makes my clients feel at home when I do this. And I feel more comfortable handling cats, for example, than dogs. Although I love dogs, but I find I prefer to be around cats. So as we sort of think about cats as species and think about them as veterinary patients, it's important for you to remember back about their evolution. Think back about all the evolutionary steps that cats will have gone through. And on the screen here is a lovely cat. It's an Abyssinian cat. And Abyssinian cats first came from Eastern Africa. It's where they originated from. Abyssinia was that part of Africa. And they're thought to be some of the very earliest domesticated cats that were domesticated from wild cats. And I used to have an Abyssinian cat. She was a gorgeous cat. And people like Abyssinian cats because as you look at her, they look a little bit like young little mountain lions. So it's nice to have a little bit of jungle in your living room with a cat like an Abyssinian there. One of the challenges that we have, I think, as veterinarians with cats like this is that although cats are domesticated, I think they are somewhat reluctantly domesticated. So they still have a little bit of the wild cat in them. Some people really like that as owners. Some people don't like that because they see their cats as being very independent. But for a lot of people who keep cats, they like the fact that the cat has kept some of its evolution, its wild evolution, in its behaviors, and they really enjoy that. Some people are cat people, some people are dog people, and we'll look at that in just a little while as we talk about this. Now on the picture here is sort of another breed of cat. This is a Bengal cat, and this is a coloration or a color of a Bengal cat called a snow leopard Bengal cat. And you can see again that for many people, when they look at a cat like this, it really looks like a wild cat. So people have bred these kind of breeds of cats to look like wild cats because they enjoy that independence of the cats in their living rooms and on the couch and on their laps. And for many of these cats like this, they behave like wild cats. They continue to have those kind of behaviors. If cats get out of our houses and they get into the countryside and they roam around, they can be very self-sufficient, and cats can live in the wild, and they can live quite happily in the wild as long as there is adequate food that is available. And cats that can live in the wild can breed with other wild cats, certain breeds of wild cats, and can produce mixes of cats. And this is a Savannah cat. This is as you can see, this is a big cat, and these ones weigh probably 15 pounds or so or more. And this is a cat that is a mixture between a simple domestic short-hair cat and an African serval cat. And people sometimes breed these wild cats, the African serval cat, with the domestic short-hair cat in order to develop cats that they can have in their living room that look like this one, that looks like something came out of the jungle. In some towns and parts of the United States, in order to own one of these Savannah cats, because that's what they're called, you have to have a special license because they do have this African cat background in them, and they can be fairly big. Most of them are very pleasant, but if they were to have an aggressive nature, they could cause a fairly nasty bite. But most of the ones that I've met have been very pleasant. So this is a mixture of a domestic cat and an African wild cat, specially designed to produce a kind of pet that looks a little bit like something from the jungle in your living room. Here's another Bengal cat. This was a kitten who was a patient of mine, a lovely kitten, and again bred in a type of color that was designed to look exotic, so that people would have an exotic looking pet in their living room. It's called a marbled Bengal. When we think about cats when they became domesticated, and we talked about the Abyssinian cat initially, cats sort of fitted easily into people's homes because they were typically small. They found that they liked to hang around people because there was food around these early civilizations as well that cats could get hold of. There was an interesting article recently about body language in cats. It was in the news in about the last month or so. those of you who have dogs will probably notice that if you take your dog to a place that looks stressful and the dog doesn't know much about, the dog will look up at you and your body language and your face to get some cues as to how they should interpret this new situation. And if we look stressful, then the dog gets stressful. If we look happy, then the dog is more confident. We didn't know that cats did the same thing actually until about a month ago when a paper was published on this that was interesting. And I'm trying to think about how do I use that information. And one way that I might use that information would be just think about when I'm taking a cat to the veterinarian, if I'm transporting the cat to the veterinarian, if I keep a positive look on my face in the car, then the cat may interpret that the visit is going to be positive. If I look worried and I'm getting stressed out as well because the cat is getting stressed out, I think that just is going to make things worse. So body language is interesting both ways, and cats pick up on our body language. Cats tend to be playful, so people enjoyed their company when in the early stages of domestication. A lot of people think cats are very intelligent and they like to be around us, so they're tame, most of them. They enjoy human company, some of them close human company, some of them not so close, and so we're going to talk about that in just a little while. So cats have gradually come into our homes more and more, and one of the reasons that cats came into our homes originally back in East Africa was that cats were attracted to the place where people kept grain and wheat when they were making their early recipes of bread and other foods, and cats found that there were lots of mice in those areas, and so cats were drawn into those areas, and then people realized that the cats were helping them, and then the cats gradually came into the households and became domesticated. So it became very much a two-way win-win relationship for those cats, and that's really how cats first, those wild cats in East Africa first came into our households. They were helpful in keeping the mice population down. The ideal food for cats actually is mice. Cats are strict carnivores. They do not tolerate in their food carbohydrates very well. And that's one of the reasons we see a lot of fat cats around in our country, is because a lot of the cat foods, especially the dry cat foods, contain a lot of carbohydrates. And so as cats are, some of the cats who live indoors are quite inactive and they eat a lot of food with carbohydrates, they tend to put on weight. And it also predisposes them to diseases like diabetes. So the ideal food for cats would be mice. And if we think about a cat who lives out in the country, who has no cat food given to her or him, the average cat has to catch about 7 or 8 mice a day. That's a lot of mice in order to meet their energy needs. And so you can imagine that they have to do a lot of running to catch those mice. They don't eat all of the mouse, they just eat the juicy bits of the mice. They don't eat all of the mouse, but it takes about 7 or 8 mice every day. So you can see they have to get lots of energy, lots of activity in order to be able to feed themselves and their kittens. If we feed cats dog food, they get certain diseases because of certain deficiencies. For example, they will get eye damage because there's an essential component that is not present in dog food that cats need, and they will become blind. So they have unique metabolism, and one of the big things that we have to watch out for as veterinarians is, especially in fat cats, if they don't eat for a while, the fat is mobilized and moved from their abdomens and under their skin and goes into their livers, and then that can cause damage of function and a failure of function of their liver. We can end up with cats with liver failure as a result of them not eating. So one of the important things about veterinary medicine and feline medicine is that if a cat hasn't eaten for 2 or 3 days, we have to be very proactive about giving the cat some nutrition in order to prevent these kind of unique complications occurring. So here's a nice picture of a Siamese cat that I found, one of my favorite breeds as well. They're noisy breeds, but they're very pretty again. And a few things about feline behaviour, cats sort of early on in their lives have a fairly short socialization period, so fairly quickly kittens get used to us as owners and begin to socialize with us. The word crepuscular up there means that cats, if they're living outside, typically are most active at dawn and dusk, probably at a time when that's good for them hunting. They like to hunt at night very often. And we saw all of those cats in Japan, all crowded together, but actually most cats like to live by themselves. And one of the problems we have in veterinary medicine is that very often people keep too many cats, and that can cause a lot of stress for our cats. So very often cats enjoy living by themselves. They don't really enjoy living in big groups. A lot of cats are self-sufficient. They become attached to us as owners and they're self-sufficient, and that makes a lot of people think that they're independent and completely independent of us. That's not true. I'm going to talk about that a little bit later on. But cats sort of enjoy what we call a commensal relationship. They are somewhat dependent on us. We're dependent on them for companionship, but it's not as tight and close a bond as for dogs, I think, between people and their pets. And lastly, I saw in the news the other day that the world's oldest living cat recently celebrated a birthday of 37. That's an old cat. But nowadays, it's not uncommon for our patients to be living in their late teens, 17 to 20. And when they get to that age, they do need a lot of veterinary care because they have a lot of diseases that can affect older cats. I'll show you a few coming up in just a little while here. So they can have they can live for a long time, but they get a lot of problems, and so they do need the care of a very good feline medicine specialist in order to help them with their quality of life and to control these various diseases of the kidneys and the thyroid gland and many of the intestines and joint diseases and dental diseases, a whole variety of things. So it's very common that our older patients have several things wrong with them, not just one thing wrong with them when they come and see us. But cats have amazing vision, especially at night, got great night vision. Their hearing is wonderful, but their sense of smell is not that good. There was a news article this week about a dog who had a wonderful sense of smell and was able to detect the presence of thyroid cancer in people by detecting the smell of chemicals that was produced by the cancer in the urine of people. And I think the dog got the correct diagnosis about 90% of the time. So dogs have amazing noses, but cats not quite as good. They rely on their hearing and their eyesight. You and I know that cats are very agile. They can jump up on things, jump down, get through tight spaces, and that's what makes them very good hunters outside. And then lastly, one sort of unique thing about cats is that their reproductive cycle is basically controlled by the length of the daylight. So as the days are getting longer now, especially with the time change that we had last weekend, that sends a stimulus to female cats to start ovulating, and that starts their reproductive cycle. So now that the days are getting longer, we're going to see in probably 2 months' time, see lots of kittens being born. So that's when lots of kittens are born, and then in late spring we see lots of kittens being presented to shelters because they don't have homes. So the reproductive cycle of cats is triggered by the length of the day. And as the day gets longer, that initiates the secretion of hormones and the whole reproductive cycle. So one of my colleagues sort of talked about the fact, and she was giving a presentation on cats, and she talked about cats being three-dimensional. And that was an interesting term, and I said, what does that mean? It means that when you think about dogs, most dogs stay on the floor, and they may jump up on the couch, but cats really enjoy having perches. We have to think about this when we're taking care of cats in our veterinary hospital. These are cats who are living in a sanctuary. But when we're talking about a veterinary hospital, it's important that we just don't put cats in cages. They need something to perch on to feel safe. And cats can feel very threatened if they're just put in an empty cage. So they really enjoy you'll see cats at home enjoying climbing trees and a whole variety of things in our home. They enjoy getting up on high areas of our closets and things. That's just part of their climbing activity. And when we have cats in a veterinary hospital, as I said, they can feel very threatened by being in a cage with nothing to hide in. So we always give them a box or something to hide in where we can monitor them and watch them, but they need to be able to get in a box. And this is a special box for cages that we're seeing here. This cat doesn't think that we can see it, but of course we can. But if we just leave the cat in a cage without anything to hide in, they get very stressed, and then that interferes with their recovery from their illnesses. So cats get stressed much more than dogs, and when they get stressed, that can make their illnesses worse, and it can also predispose to some illnesses that we're going to talk about in just a little while. So here's a couple of examples of cats have hundreds of different medical problems, but I thought you'd be interested in this one because I was going to show you 2 or 3 examples here of diseases of cats that people get too. And I'm sure some people in the audience have had to take asthma inhalers. Asthma is a disease where our airway, our breathing tubes, suddenly constrict and get smaller, and we have difficulty breathing because our trachea and our bronchial tree, as part of our anatomy, suddenly constricts, usually due to an allergic response. And we have to take drugs to decrease the inflammation, and we have to take drugs to open up the airway. And for many of us who have asthma, we will often use an inhaler, and you're seeing a cat here who's been trained to use an inhaler, and this works very well. The cat takes we give it 1 puff in that inhaler twice a day, every 12 hours, and the cat breathes in and out of that cylinder that you see there, and breathes in a steroid drug or a drug to help open up the airways. So cats get sort of same kind of things that we do. Now, cats get a lot of infectious diseases as well. This is a kitten who came from a shelter, and you can see that it's got a lot of discharge from its nose and its eyes. It has one of the many respiratory viruses that cats will get. And so as feline specialists, we deal with a lot of different infectious diseases, and these are very easily spread when cats are in groups. So that's another reason for not keeping a lot of cats close together, because they will spread all kinds of different diseases. And there are probably 20 or 30 important infectious diseases of cats, and I'm just showing you one example here of an infectious virus that can happen in shelters. This one is Herpes virus of cats. Now, as cats get older, they can develop diseases like kidney disease or thyroid, diseases of their thyroid glands that can predispose them to developing high blood pressure. And when they get high blood pressure, it can damage their eyes or their hearts or their brain or their kidneys. And so part of the care of older cats is to go ahead and measure their blood pressure on a regular basis. And I just showed you a picture there of one of my colleagues who's a technician sitting in a nice quiet room with one of my patients taking the blood pressure. And we use a cuff on the arm just like you and I might have when we get our blood pressure taken. And for older cats, we probably would do that every 6 months. And for cats who have a problem like kidney disease or thyroid disease that can predispose them to high blood pressure, then typically we may check their blood pressures every 2 to 3 months, because high blood pressure can be very damaging to them. So you can see we do the same kind of things in cats and dogs that we do for people as well. Here's a cat who has diabetes, and you've all heard of diabetes in people, where we are normally able to control our blood sugar levels. And this cat has diabetes, and one of the things that this cat has is the diabetes has damaged this cat's nerves. And you can see the way this cat is walking, that it is sinking down on its back legs, and its back legs look sort of flat, and its front legs do too. So it's sort of sinking down as though it's weak on its legs. And this is a result of the diabetes damaging the cat's nerves. And diabetes has become a very common problem in cats as cats have had a tendency towards obesity, and as we've been feeding them foods that are high in carbohydrates, and so we've changed the kind of foods we're feeding cats recently, and we're trying to get them to become more active to try and decrease this problem with diabetes. Now, cats get a lot of dental disease, and I'm showing you a picture of a cat's mouth here, and the cat is under an anesthetic, and I think you can see on the teeth underneath that lip that there's a lot of tartar, a lot of accumulation of material there, and the gums look very red and painful. And it's difficult to brush cats' teeth every day. It's easier in dogs. And so good dental care is important. I showed you my colleague who's a veterinary dentist, but typically we recommend that there is a good dental cleaning done at least every year in cats to prevent this kind of progression of disease. Now, not only does this not look very nice, but the likelihood is this cat's got cavities and other problems and abscesses and infections that can be very painful. So it's a really important quality of life issue, not just a cosmetic issue. And these cats feel much better when the bad teeth have been extracted or their teeth have been cleaned. And so they become more playful, they become more interactive. You can tell that their life is much better once their chronic toothache has gone away. So those are just a few examples of some diseases of cats that we're going to talk about. But I wanted to talk about a little something here that is close to my heart, with the fact that there are more cats than dogs in this country. But the problem is that people are not taking their cats to the veterinarian often enough. And you can see on the screen here that from 2001 to 2011, actually there was a significant drop in the number of visits of people taking their cats to the veterinarian, in spite of the fact that the number of cats that we have in this country is going up. So I want you to be thinking about, why might that be? What in your experience can you think about might have prevented your family from taking your cat to the veterinarian? And so I'm going to just show you a few things that came out of here from a recent study, which I think is interesting. And those of you who are interested in veterinary medicine and are going to be pursuing that as a career, be thinking about this because it will help your practices in the future. So here's a nice cat and a dog on the picture here getting on well together. And the first thing is, interestingly, that most cats find their owners. So most people don't go out looking for a cat at the shelter or somewhere like that. A cat appears at the back door. And so in that kind of situation, it may not be linked with a visit to the veterinarian. A cat shows up at the back door, and it may take quite a while before people decide, this cat's going to stay with me forever, and I'm going to go ahead and invest some money, take this cat to the veterinarian. But, in contrast, most owners find their dogs. So it isn't the fact that dogs show up at the back door. People go out to the shelter or they go and buy a dog, and linked with that is usually some kind of early wellness exam with a veterinarian. And so that is the first thing I think that means that people don't take their cats to the veterinarian very often. Now if we look at the next slide here, another nice cat and dog on the slide here, when we think about our pets as family members, more people think about their dogs as companions and family members when we ask them about it. Most people, if they have cats, talk about their cats as pets. Now that's not the same for everybody, but for most people they think about their cats as pets, but when they talk about their dogs, the dog is a member of our family. And so they place a different priority on cats and dogs. And these are some of the things we need to sort of try and break down as veterinarians and improve upon. And here's another picture of a cat and dog. And the moral of the story here is that for people who own cats and dogs, so they tend to think about themselves as dog persons who own cats, not cat people who own dogs. They often put the dogs first. Now this doesn't apply to everybody, but it really is one of the challenges about how do we get people who own cats to go to the veterinarian. So think about your families on these kind of things. The other thing we have to think about is that when people take their animals to veterinarians, people in general tend to think more veterinarians are dog-oriented than cat-oriented. More veterinarians are comfortable with dogs than they are with cats, and people pick up on that pretty quickly. So for some cat owners, they may choose not to go to a convenient practice because the people there just aren't very comfortable with cats. And cats are very often more challenging to most veterinarians. They have that sort of wild situation back in them, and most veterinarians still don't, or many veterinarians still don't understand cats very well and understand their diseases. And you can see the cat in the cage here doesn't have anywhere to hide. I think you can look at that cat and see that that cat looks very stressed. This was a sick cat, but you can see that it looks stressed, and we need to have somewhere in that cage for that cat to hide so that it doesn't feel threatened. Cats, because they still are not fully domesticated, they still have this wild streak in them, they protect themselves by hiding their illnesses from animals that may be wanting to hunt them, for example. So if cats are out in the wild, they're not going to show their illnesses like dogs. And if dogs have joint disease and they've got arthritis, for example, we will see that quite early on because the dogs will limp and have problems. In cats will just sit still. They won't show us those clinical signs. And very often when we see cats as patients, their illness is much more advanced than the owner realizes because cats have been hiding their illnesses. And so this causes a big challenge for us as veterinarians. They also hide their pain, and so that's an important thing as well. Picture of a couple of kids here. Actually, these are my grandkids with their dog when they were much younger. They would be embarrassed to see their pictures up there today. But when we think about dogs in our family, people talk about their dogs being high maintenance and very dependent on us. That's what they like. My dog is high maintenance and very dependent on us and dependent on everything. Now, when you get to cats, people think differently. This is what people think. It doesn't mean to say that that's correct. So people think of their cats as, low maintenance, doesn't need much veterinary care, very independent, can handle life by himself or herself. And actually that's not right. Cats need just as much veterinary care and care in general as dogs, but people tend to think that differently. And then lastly, here's Fritz. He's an older cat, and if I was to list the number of things that wrong with Fritz, we would be here for another 10 minutes or so beyond the end of this class, but he had 6 or 8 different things wrong with him. He was a lovely cat, and we had his picture taken at the college. But one of the important things that people don't recognize with cats is that they need to have their annual examinations to make sure that they are well just as much as dogs. And when they get older, like Fritz was 17 in this picture, they need to have that every 6 months. So although cats may seem to look fine, they hide their illnesses and they need some really good care just in the same way as we do otherwise. Just a couple of last slides. Here's a picture of a cat. This is why people don't like to take their cats to the veterinarian, I think, because of the stress of the trip for the cat and for the owner. And so as veterinarians, we have to educate our owners about how do we make that less stressful for the cat. And one of the things is perhaps when cats are kittens, we allow them to have access to their carriers like this just as they run around the house, and they can use this as a bed. And sometimes what we'll recommend is that the kitten goes in the carrier and we take the cat for a ride in the car, and we never go to the veterinarian. We just go do a little tour around the neighborhood and come back, so that the cat doesn't always associate the carrier with going somewhere bad. And using our body language too may help the cat. You've probably seen cats rub up against things and rub up against tables and rub up against us with their faces and their cheeks. And when they're doing that, they are leaving a pheromone or a chemical on there that is a calming chemical on the furniture and elsewhere as a signal that they have been there. And there's a synthetic form of that as a spray that we can buy. You can buy it in pet shops or the veterinarians, and we can use that as a spray inside cages like this to be calming for these cats as well. So lots of different things that we can do. And then I think my last slide up here is what do we do as veterinarians in hospitals to decrease this stress on cats. This is our clinic hospital in the small animal area, and it's about to undergo a big renovation, and one of the things we're going to have to do is make separate areas for cats and dogs so that the cats don't get stressed in the waiting room, they don't smell the odors of the dogs, they don't hear the dogs, they don't see the dogs, those kind of important things. We like to make sure that in the veterinary hospital waiting room that cats cannot see each other, so the seats have to be placed in a way when the cats are put down that they don't make eye contact. And again, remember that cats like to be off the floor, so we like to have ledges and shelves and things for them there. So that's my presentation on cats. This is my last slide. This is a beautiful ragdoll cat. She was one of my patients and enjoyed taking care of her. And I'm happy in any way possible to answer questions about cats, their physiology, their anatomy if I can, veterinary medicine as a whole, specialization in veterinary medicine. I've specialized a lot. I've not only become interested in internal medicine, but I limited that to a species too with cats, and I've thoroughly enjoyed that. It's allowed me to do a lot in my career. Had an opportunity to travel around the world, lecturing, and had a chance to work on books and a variety of things. So it's offered me a lot of wonderful opportunities to develop some unique expertise like that. So I'm very happy to answer any questions if I...
Would you name off some of the diseases that are transmitted between cats and humans?
Good. So that's a very good question, because cats often get a bad rap and reputation for transmitting diseases, and there are some important ones, one of which is toxoplasmosis. Toxoplasmosis is a disease that is especially important for, it can be transmitted between cats and people, usually indirectly, not by touching cats, but by coming in contact with cat litter or cat feces that is in the yard outside, those kind of things. And it has special importance for pregnant women and special importance for people who have a damaged immune system. Toxoplasmosis can cause some serious problems. Another one that's an interesting one is cat scratch disease, and that is caused by a bacteria called Bartonella, and actually is transmitted by cats inoculating with their claws the flea dirt or flea feces from fleas that have been feeding on the blood of that cat. So if a cat has fleas and the fleas have been feeding on the cat and the fleas have flea dirt or their feces that contains this bacteria that the flea acquired from drinking the blood of the cat, if the claw of the cat has some of that flea dirt on it and scratches the cat, that can cause cat scratch disease, which can be an important cause of fever and enlarged lymph nodes and other problems. Now, cats can also transmit rabies. That's an important problem. I was bitten once by a cat with rabies. I had to get a lot of injections after that. We have to be very careful about vaccinating cats. Ringworm is another one, which is a fungal infection of the skin, so cats can cause us to develop ringworm, fungal infections. There are quite a few important diseases that cats can transmit to people, and our role as veterinarians is to make sure that that risk is minimized to people, especially those people who might be at risk. So that's a great question to get things kicked off.
You mentioned cats reproduce quickly. Should we have our animals spayed?
Absolutely. The cat overpopulation problem and feral cat problem is an enormous issue. There are too many cats who are not part of loving homes, who have to fend for themselves. There are too many cats in shelters who are never adopted. One of the bad reputations that cats get also, to some extent, is that cats who live outside, like feral cats, may be eating too many wild birds, and so people who are bird lovers often point the fingers at cats for destroying the songbirds and those kind of things. But yes, every cat should be spayed, and male cats should be neutered. and we typically recommend that somewhere around about five months of age. That's the responsible thing to do, both for the cat and for the environment and for the owner as well. There are just too many cats who don't have homes, and so that's a very important part of the kind of recommendations that we give to owners when on that first visit when they've acquired a new kitten, and we want to make sure we follow up with that.
You mentioned that a recent article indicated that the cats view your posture and all like dogs do. But earlier on, when you were talking about your training, you said you got along well with cats. So are those different or the same thing?
I grew up with cats. My parents, when I was growing up, had cats. They only had one or two at a time. I just felt comfortable around them, and I think that just got me used to that early on. When I'm around cats, I tend to be quiet. I tend to be calm. I tend to not make many noises around them. So the cats pick up on the fact that I tend to be a calm person when I'm examining them. And I think it just takes all of those different things to perhaps be a good feline veterinarian. So we turn the lights down when we're examining cats, we turn the sound down, and all of those things to make it as stress-free a situation as possible.
You have several veterinary students come to the training. How do you tell them that the cat is different or requires a different treatment than, say, a dog?
At Texas A&M, we have a rotation for our students in the clinics. I think we're the only veterinary school in the country that focuses uniquely on cats. So for 2 weeks, our students focus on observing how we examine cats, examining cats and doing a physical examination, and being able to do a really good physical examination on cats is very important because cats don't give us many clues about their illnesses. And so there are just a variety of techniques and attitudes that we instill in the students, and they quickly understand that in the way that we handle cats, that things are going to be very different from dogs.
Should you feed cat dog food?
No. Should you feed cats dog food? Dog food doesn't contain enough of the amino acid taurine for cats. Cats require taurine, Taurine, for their normal eye function. And if cats are fed dog food exclusively, they will develop retinal damage and retinal degeneration, and they can become blind. And dog food doesn't contain enough protein and contains too many carbohydrates. So it's not good for cats, and cats will develop diseases if they are fed dog food exclusively.
You mentioned that some people like cats because they like the independentness of it, or different characteristics of the cats, maybe the color, or maybe they like the cat to be part of the scenery that they have in the house. Why do you like cats?
I like cats because they always remind me that they're not fully domesticated. I enjoy having an animal in the house that reminds me that they're still perhaps part of the jungle. And I think if you looked at any of the cats that we saw today and you looked at their colors, if you and I went to Costa Rica or we went to South Africa or wherever we would go in the world, Australia, and if one of those cats walked out of the jungle or walked out of a woods, we would be impressed in thinking that is a wonderfully exotic creature. So they have very exotic colors, they have a nice independence, and they sort of tell us, I'm not quite domesticated, I'm still a little bit wild, and I love those features of cats.
What percentage of the veterinary students want to concentrate on the cats?
It's probably maybe 3 or 4% would want to some of them have a strong interest in cats, but for those who would want to say, I want to do cats only for the rest of my professional career, 3 or 4% probably.
And mostly girls?
Mostly women. I think the guys yet, I'm a little unusual, I think, in being a cat guy. I just think perhaps the mannerisms and the calmness of women goes along well with feline practice, and so I think they do especially well in that area. That's correct.